Welcome back. From new cases spreading to a possible booster shot for kids, we are following several new developments on coronavirus as new cases rise. And we are joined right now live by Dr. Jeff Pothof from UW Health. Thanks for being here, Dr. Pothof. I want to start with booster shots for kids. U.S. regulators have just approved Pfizer booster shots for healthy kids 5 to 11. The CDC still needs to sign off on this, but if approved, how much more protection do you think that booster could offer kids?
You know, what we know about these booster shots, especially in the day and age of Omicron and these contagious subvariants of Omicron, that booster shot does afford a fair bit of protection against severe disease, will decrease the risk slightly of even coming down with symptoms if those children are exposed to COVID. And even though kids don't suffer severe disease as often as adults, some do suffer severe disease, and kids are susceptible to those other side effects, long haul COVID and the like.
I imagine a lot of parents are encouraged to hear that development this afternoon. Wisconsin is seeing more counties in yellow and red, or medium and high transmission rates. That's according to the CDC. Milwaukee County in the yellow right now, Racine and Kenosha counties in the red. Dr. Pothof, what exactly do those levels mean, and do you think we'll see an increase in hospitalizations?
Right. So these levels are pegged to a couple of different metrics. So one is the total number of cases of COVID-19. I think that one makes sense. But likewise, they also look at hospital capacity in those counties, i.e. if there is an increase in cases, can those health systems absorb more patients? And then there's recommendations that go on top of that. So green is, don't worry about the mask. Things are looking pretty good. Yellow is, you really got to consider about putting a mask on if you're at risk, immunocompromised, maybe you have cancer or an organ transplant. Red, that means transmission is so high that all of us, when we go indoors in public spaces, should consider wearing a mask to decrease that transmission so that we don't have hospitalizations that increase at a rate that the health system in that county can't handle. I think this time around, we may see an increase in hospitalizations, but I don't think it'll be as large as our previous surges. I think there is enough immunity in the community where that rise in hospitalization should stay pretty flat or only slightly increase.
Okay, that's some good news there. Now, as we head into the summer months, the city of Milwaukee says opening up windows could help reduce the risk of COVID. How much of an impact could opening up a window have? What do we know about fresh air?
Yeah, so we know that the more air movement, the better as far as COVID-19 goes. So certainly if you're in an indoor space and people are crowded together, having the windows open would be better than having them closed. Although I can't look at you with a straight face and say just opening the windows is going to remarkably reduce that risk. I'd still be looking at my risk factors and understanding, is that an environment that I want to be in the summer, indoors, windows open or closed, if the case levels are really high.
Yeah, important perspective there. Thank you, Dr. Pothof. We always enjoy your time and your insight.
Thank you.
Thanks. A reminder, you can always find the latest information on the pandemic at tmj4.com/coronavirus.